Hello. Welcome
Hi.
everybody. Hi.
Hello.
Uh,
Very good evening,
yeah.
everyone.
So let me just introduce Dr. Prachi. Yeah. Okay.
Sure, sure.
Yeah. Yeah. So first of all, to everybody, extremely sorry for this, inordinate delay. It's seemingly inevitable. I know I started earlier, but we could not continue. So this is the second time, and hopefully it'll go through well. So because we've never ever had such a delay. Anyway, so welcome everybody, and apologies if I closed abruptly earlier, and now we are definitely continuing the live. Thanks for joining. I'm Ritash, one of the co-founders of Rang, and a hearty welcome especially to people who have recently started following us and are joining our live for the first time. We've been having these Insta lives regularly, from last year. Prior to that, we used to have them periodically, and also sometimes only as Google Meets. So the idea behind these, we call them queering conversations or queering some particular topics or arenas. So it's about bringing to you all, fellow intersectional queers from across India, and actually I must say the world. Of as if you have been a regular follower, you would know that we had people from other countries also participating in the live. I am a panromantic, gender fluid, neuroqueer ace. I also have invisible disabilities and chronic illnesses. 51, multilingual, peer counselor, and a writer. Okay, and we are very pleased to welcome Dr. Praacchi Rathod. She's a trans woman. She's a physician, in Telangana. Largely has been Hyderabad based, worked with the Mitra Clinic, which was exclusively for trans persons, in Hyderabad. And now Dr. Prachi is pursuing her residency, her PG in orthopedic surgery. In between, she also worked as a chief medical officer at the ART Center in Usmania General Hospital, which, of course, for people who know Hyderabad, Telangana, it's a very old and a reputed hospital. So, welcome, Dr. Prachi. As we go along, we will know that Dr. Prachi is also quite a polyglot. She speaks four languages: Telugu, Hindi, Marathi, and English. And she has, of course, faced her share, or rather, no one deserves to face any harassment or discrimination based on any marginalization. But of course, she has braved it all and continues, reaching out to not just our queer communities, but or individuals, but also to people, because as a doctor, you're supposed to serve anybody who needs your support, right? So, so Dr. Prachi, without much ado, we will start. Uh, though largely this will be in English, we might ask you questions a little bit in Telugu and Hindi for any followers, live joinees who are more comfortable in those languages. Apart from that, people, of course, unless you are from Nestam Sogs or collaborator, or uh, life gets beautiful today, we will not be able to, or of course my co-founders at Rang, we will not be able to add you to the live. You can interact respectfully in the comments, okay? And of course, if you need translations, as I told you what all languages Dr. Prachi knows. I know Telugu, Hindi, English, Kannada, and Tamil. So, so we have a multitude of languages that we can interact in if you people want to. Okay. So, all right. So, Dr. Prachi, yeah,
Yes.
this will be a free flowing conversation as I briefed you. Sorry. So, yeah, how would you want to share about, or rather, what would you want to share about your life journey? I know you have on one-on-one, and of course, with various articles and interviews I've read about with you. You have periodically, revealed some parts of yourself or some sides of yourself. But unlike you emphasized, um, as a doctor, of course, you found that the community, especially trans persons, were very comfortable and happy and felt safe with you, and of course other people too, patients and stuff. um yeah, but anything specific in these experiences? We will come to your professional peers and seniors. Unfortunately, I think their let me say approach or attitudes have not been very healthy. Yeah. So yeah, so probably we will start with that, and of course go back and forth, with your life journey as such. All right. Yeah.
Sure, sure. First of all, I'm really sorry. Please kindly accept my sincere apologies because I was little stuck in traffic, so I couldn't manage the time.
Mm.
And yes, asking about life journey for every trans person is same. Instead of talking that what we have done, how much we have struggled in the past, each and every transgenders, I mean to say trans persons, trans women, trans men's as well, if they come out in their family, definitely they'll be throwing out. No parents are accepting. They are choosing like male, female beyond the other gender. So yes, let's not talk about that. But yes, I can only say I am one of the transgender who did each and every transgender's activities like begging on streets. Going for badais and everything. And but somewhere I can also say I'm the only transgender person. By doing all this, I continued my studies as well. I never stopped in between because I never wanted to leave that kind of life. Uh, just the only thing which was running in my mind that one day if my parents see if they find me on signals, so I won't able to face them throughout the life. Though they are not in touch now, but yes. So that was the only triggering point. So I thought like why to discontinue my studies and all. Uh, it was there like tough. Discrimination was definitely there. Life was very tough at that point. We get lot of thoughts like committing suicide. We'll be in depression and all. But yes, somewhere I have managed with the help of psychiatrists, many, my, I mean to say many psychiatric consultations. So somewhere I found that there is something inside me, and I have only picked up that, and I started my career again.
Thank you so much for sharing that. I think I will have to say thank you
Thank
many
you.
times, but each and word of what you just said is not just important. Like you said, many of us, broadly queer people, gender sexual romantic minorities, LGBTQIA plus, whatever we call ourselves specifically, we, I think, unfortunately, and actually, it's also a very unpalatable and a very distressing situation that facing discrimination and alienation is so normal, right? And it's like, we must be surprised, happy, forget about ourselves, even if another a queer person or a trans person or a gay person is not faced discrimination. Yeah. I think, and it's sad because actually discrimination is also violence. Exclusion, alienation is violence of a different kind, psychological, emotional, and which, physically we can't see the scars. Physically, some scars will heal, but they cause trauma and all that. But the unhealed and the invisible scars, which we have to live with, are very, very tough. But then I guess we are tougher than that. But of course, many of our community members are not so lucky. Let me say, this is definitely not a benchmark of their vulnerability or toughness or anything. Somehow, people, some
Yes.
cannot take it, some can, and that's, we're delighted whenever people are able to survive and surpass these things, and we're glad that you're one of them. And as a healthcare professional, believe me, as a counselor, but I'm also first a human being and a neurodivergent queer human being with, my own other health challenges and all. Somewhere we are supposed to have that something extra, no? Whether you call it toughness, strength, or whatever, right? Uh, but also, because of also the coexisting vulnerabilities, right, it is not always possible for us to help or reach out to everybody or assist whoever seeks our support or assistance, or whoever, whatever, right. Having said that, uh, do you think somewhere it's also a bit of pressure on us who are in directly as physicians like you, or peer counselors like me, broadly helping with specifically helping only with mental health? um, do you think somewhere we get stressed a little more, and we are not getting the care, or rather we are not seeking the self-care we need? We sort of don't prioritize till it becomes too much for us also. Yeah. And would you like to say something about this, as to we as support providers, what is it, this extra we are supposed to have?
That's a very good question, actually. I'll start with this point. Somewhere, like we are the persons from the community, which everyone is facing same kind of problem. But as a front face, you have a lot of responsibilities we have to express to the society, and as well as we have to show to our community people that, see, these are the things, if we overcome, we can move forward. So somewhere I can only say, like, a kind of confidence, self-confidence is very important to us, and also sustainability, connection with the community. Sorry, with the society as well as with community is very, very much important. Where we are like a barriers in between the society and community. So these kind of like sustainability, or I can say sustainability is very, very important. Your self-confidence, and also you have that ability to understand both ways, like not to be in hurry, not so aggressive, and all these things. So these are few things we have to take care of. And being a barrier, I can only say there are a lot of negativity we get from the society, and
True.
that kind of negativity won't be people who are from the community, who are at ground level, like especially in rural areas, they might not face that kind of harsh statements, or calling them with some other pronouns, or it might be like calling them with various like names which are already like
Yeah.
forcefully kept by the society, and also somewhere it won't reach, but we are the one, we always we have to face that. And also, what I feel is like, kind of we always blame the society, we always blame cisgender, or the constitution, which I say, because like what I have to say is, yeah, we always blame them, but there is some kind of responsibility towards, from the community, where we have to practice. See, if we are, I can say there are like religion minorities are there. We are a kind of sexual minority, but there are some points. I mean, there are some like particular points where to behave, how to talk, how to walk, and how to behave with the cisgender people. is very important that actually lacks in our community. So I personally feel like guiding to our community, sensitization to the community, where not each and every person from the society is negative.
Okay.
Not each and every person in the society is not accepting you. We are in the, in 2023 now.
24.
Sorry. We are in 2024. So definitely, like I can sense that. See, I have transformed myself 10 years back, and I can see a lot of change in the community as well. But at least we should not expect 100% change, right?
Yeah. Yeah.
So somewhere I feel rather than concentrating or focusing on our personal life, we always blame the society that they are not providing this to us, they are not doing this to us. Why do they do? I mean, we have to put a step forward for all these things, right?
Mm.
Yeah.
Right.
For acceptations, you should accept yourself. You should eliminate the negative things from your life. I mean, from your journey, and you have to step forward.
Mm.
Then only that kind of acceptability will be there.
Right. Right. Okay. Thank you. Yeah. Vital, because it's also yeah, wow, you use the word barrier in such a positive way. We are like, barrier, bridge, whatever. Sort of,
Yes.
we kind of assume this responsibility of be safekeeping people who are much more vulnerable than us. That's probably what you meant. Right.
Yes.
And also, the other important thing, self reflection regularly is vital. Looking inwards. I mean, nobody is perfect and everyone's learning and growing, hopefully. The bad elements will be there everywhere. Unfortunately, they are more visible and maybe more powerful or whatever. Actually, to me, power and insecurity are very interconnected. So, but I think if we focus on strengthening ourselves, that's what I hear you.
Yes.
That, uh, and these some of us who have probably taken this responsibility or that feeling or that call inside that, we can somehow reach out to others or assist people who reach out to us. Again, I think sometimes we have greater responsibility. Sometimes, the way we have grown, the responsibility automatically falls on us, and we should use that, I think, wisely, carefully. Yeah. While, sort of supporting our community to the extent possible, we should, of course,
Yes.
be accepting of critique, positive critique and feedback, and see how we can build those bridges, right? Yeah. But having said that, right, I know, as you say, we have seen uh, some things move forward, and unfortunately many are in a pressure situation, especially in these metros where anything and everything is immediately people are there to take pictures and videos and then post them here and there, spread rumors and all that. There are always people, and as if that's not enough, there are the so-called media organizations who are doing more mess, creating more mess than meaning, right? So, so amidst all this, you as a professional, a doctor, right? As a healthcare professional, right? And I recall you telling me in healthcare, definitely all of us LGBTQIA plus people have more mental health needs, and some of us have lots of physical health needs also, and both are equally tied, right? It's not like mental health separates to this thing. And as a doctor, you're supposed to take a holistic approach. I mean, even as a counselor, even if I do not deal with physical health directly, I will ask them, right? So whoever approaches us, right? So, but also we have seen some great disappointments from healthcare professionals who are cisgender, or, where actually we need the maximum support, right? But what's happening
Yes.
is, apart from discrimination and disrespect, I think the other extreme is pathologization, right? Oh, you need to be treated. Yeah. If you're intersex, then something is wrong with you. If you are asexual,
Yeah.
me, oh, you have, what is that? Hormonal deficiency. If you're trans, oh, why aren't you happy with how you are? ఇలా చాలానే బాగున్నారు కదా, ఎందుకు మారుతారు? ఏమన్నా మెంటల్? Sorry to use this, but it's exactly what people say.
Yes.
It's automatically,
Yeah.
people are supposed to take the oath and say that sensitivity and patience have to be part of me, right? We are not seeing that to the extent we should, right? Would you like to reflect on that? I.
Sure, sure. See, again, this is an interesting question, and where we have to focus on this from now at least. Being a person from LGBTQIA plus umbrella, we are always trying to focus only on the employment thing.
Mm.
We are demanding it to the IT people. We are demanding in various MNCs that we transgender people need some kind of job for the survival. By that, we'll get some kind of employment, and might be the like the mortality rate or whatever it is, the toxicity or the harassment which might be reduced. And we are also like focusing on the sensitization part more, sensitizing in MNCs and all these things. But we always fail to impress the health sector people. I don't know why. Being a person from the health fraternity, I can only say not even single person out of 100 knows the exact meaning of LGBTQIA plus. So this is like this is literally a kind of slap on my face because see what I feel, instead of only focusing more on the employment part, we have to campaign in the medical colleges as well, which we are doing, but we are failing to impress them all the time. I can add one point. People here now it has become mandatory in the government hospitals that there should be a transgender clinic in a government sectors, and that is the only reason. Like uh, they are just establishing a clinic. That's it, but they don't know that kind of knowledge.
Mm.
There won't be any kind of what we call health accessibility and assessment as well. There won't be any kind of health assessment. They are just like they have kept it officially only for 1 hour per week. That's it, and they are doing their job. But
Mm.
somewhere we have to put our step forward and we have to sensitize them. And yes, not 100%, but I can say that 10 to 20% of doctors who are like friends of, I mean, my college friends or something, they are little bit aware of all these things, but most of them they avoid to, give a consultations as well because there is always, I have been to many doctors in private sector. I have asked for only one thing, sir. What is the thing which you are stepping back for not giving us proper health access? Then he said only one thing. People from your community are very rude. If something or some if something happens when we are giving some kind of treatment, we won't able to, I mean, make them understand that that was the actual complication. They'll come and directly beat us. So that is one of the reason where, and which is actually true. We have created that kind of aura in the society that if something happens wrong or if someone won't give some kind of money, will be definitely doing that. So I asked few of my friends, they have told me the same. Like, no, we don't want to take any risk. We are budding doctors. Now we are at the age of like 36, 37. We have completed our post graduations, and we are I mean, in a place of making our life, settling our life. So these are few things which are making them to step back. Yes, but few of the psychiatrists and psychiatrists are like okay to give the services, just because of they also don't have proper awareness and knowledge about our thing. This is one, and also the second thing I have to add is not mentioning about sex, gender, sexuality, like various what we call pronouns and all in the medical curriculum is also one of the main thing that where health sector is lagging behind. So
Right, right.
that is adding all these things in a medical curriculum will be very important, and also teaching medical students in their first year of graduation is very important.
Right, right. So, so valid. I mean, I've heard this, and I myself, because I have sensitized doctors many, many times, it's a continuous process, and yeah, some accept, but most take quite some time. It's easier for somebody to say, oh my gosh, this is so tough for me, so many years I haven't met any trans person, or because they presume, right, because they have only one idea or of one picture or one image or imagination of trans persons. So they presume that everybody else they see is not trans or is not queer or what, right? So yes, I think mutual patience is required, which I think is lacking. But I think because again, as you say, we should not blame, but reality is one side the doctors say these the trans persons or sometimes other queer people sort of misbehave, sometimes they try to what do you call it, in a very crude way line marna shuru karte hain kabhi kaba wo.
Yes, yes,
This is something that I accept, and people have
yeah,
confessed also. यार वो डॉक्टर को देखना था कितना क्यूट था. I mean मतलब as people we tend to appreciate, but we should draw boundaries. Similarly, I
yes,
know that our own patients, clients can feel they can have a romantic something, but we draw boundaries, right?
true, true,
You
true,
know,
true.
know where to handle or how to handle these feelings, right? Or how emotions. Yeah. Similarly, yes. And also, I think, uh, no harm in telling doctors that, boss, stop, you know, if you don't want to treat me or if you only want to mistreat me, fine, I will not come to you. uh, and I think no harm in politely but firmly putting it across to them, because simply avoiding say a specialist is only going to be our loss. But having said that, it's kind of, as you say, a two-way this thing. And I think, as you also very importantly said, we have to work extra to include this in the undergraduate medical curriculum, whether they are studying nursing or pharmacy or physiotherapy or this thing. Essentially, the first year's courses are all usually similar, right? We must, because the sooner they learn, the better. And also for them to say that queer people, trans people are not outside. A doctor can be queer, can be trans, can be gay, can be anything. So that is
Yes,
one thing. Like we can have doctors who have disability. That doesn't make them any less capable or more unstable. That is a very important thing. Plus, also, I think the other part of the education system, like trying to convince schools and colleges, and especially I think high schools, because that is when teenagers with puberty and hormone changes and everything, they need much more what do you call, not just lessons or sensitization on sexuality, an affirmative environment that it is okay to be different, to feel different, to explore. I think these are all so important for us to tackle through the
yes,
education system much earlier. Of course, unfortunately, there are lots of dropouts, lot of children who don't go to school, but some way of reaching out, maybe to government child health centers or something like that. So essentially, ensuring that child and adolescent health includes this kind of curriculum or addressing these needs of people who are not in the formal education system. Essentially, seeing this not as something to be treated, but rather to be addressed positively. Okay. And of course, the family members, the caregivers, the parents, whoever they are with, grandparents, whoever with, yeah, to so that we are not an exception. Yeah, you know they should, while we are so proud that there is somebody like you or a Dr. Aksa Sheikh or a Dr. Beyonce, you
Yes.
should be as common as anybody else, that we don't have to say, oh, there are only some handful of trans doctors, or
Trans doctor,
yeah,
yeah,
or queer
and
doctors.
full of counselors.
I
Uh,
doctors who are not out because they say their patients might stop coming to them. But what
that is
also,
yes, that is actually the that is actually. I'm sorry for
no
interrupting.
interruption, I
That is
will answer.
actually actually a main like main thing where doctors won't come out. You just imagine like being a trans person where I'm like I'm only able to survive only for 7 months there, right?
Mm,
Just because of discrimination and everything. So leave about people who are gay or bisexuals. If they come to know, their life will be horrible.
right, right, right.
And yes, as the only source of income, yes, of course, each and every doctor they spend a lot of money on their career, on their education. So yes, for them, earning on the right time, right way is also important. That might be one of the main reason where the patient, where I mean, their foot flow will fall if they come out of their closet. So yes, it is kindly, I mean, acceptable, but yes, that is one of the main reason I can say where many of them won't come out.
True, true, true. And also, the other thing, actually, let us go specifically to about you. We've talked,
Sure,
of
sure.
course, not that any of this is not applicable to you. You're talking from your experiences, but a little bit about your life journey, Dr. Prachi. I know you said that right at the beginning of the conversation, and also when we were talking earlier this week, you said that your parents wanted you to be a doctor and you fulfilled that, but unfortunately after your transition, that you're sort of say missing that support from your parents, right? So but otherwise,
Yes.
how has this whole studying medicine been, and the relationship with your family, how has it changed?
Uh, it, it was very good. It was very good when I was in childhood. I belongs from an Orthodox family, which is a very big, huge joint family, I can say. I have a very good connection with my girl gang in my family, I can say. Not so much like not so much connected with boys. No, I used to hang out only with girls, and I used to be like they used to treat me like their sister only, not exactly, but they are not aware of my gender or sexual orientation. So yes, when it come to no to my family, definitely I thought they might be kind of they'll accept it because they are very much educated by the way. So I thought there will be a kind of acceptability. I was never in a state of mind that no, because of my gender, my family would leave me. So that was actually a kind of little shock for me. But yes, I always come with a positive note, and I always think, and at that point also, I have only thought about myself. I thought might be God has only given this specific 25 years for me to connect with my family, and rest of the years I have to focus on my thing. So the Yes, eventually, even I was in a state of mind, if I go good, if I do good, if I become a doctor, because as you mentioned, and I told you earlier that it was my father's dream. Yes, by hook or crook, I wanted to fulfill his dream. And also, I promised him that one day I'll be in such a, I mean, in a position that people might tell you that.
Hello, Dr. Prachi, you there? Think, sorry, I think slight connection issue. We'll just,
I'm sorry, got a call. I just got a call. I'm sorry.
no problem. Please continue.
He should regret that why we left our son on the basis of their gender. So that was only one point running in my mind, because I was uh, like I was never a kind of studious person. I always used to chill, hang out myself and all. But for at least his sake, I have done my MBBS. And somewhere, what I felt is like, after doing my graduation, yes, if gender is the only thing which is making me away from my family, then I have to work on that, which I did. But yes, not everyone will be getting that kind of accessibility, and not every person from the community won't be so confident to come out. So this is the journey with my family, and somewhere I feel bad that just because of gender they have left me. But I also thankful to the entire community and like God, that yes, at least I have got an LGBTQ family that where I can share everything. So yes, I'm okay now.
Great, wonderful. That is what, that you said, self-sustainability. I liked how you use, because self-sustainability is rarely used and even more rarely practiced. But I think that's a wonderful thing we should say, sorry, and learn from this. I had so many other great things to learn from you, Dr. Prachi.
Thank
And
you.
also, you know, but you also shared some very positive feedback and experiences with your patients, or the people who came either to Mitra Clinic or even Usmania General Hospital, the ART center. So, and of course your colleagues there, yeah, maybe say, if we might say, they might not have been directly physicians, but anyway, the support staff there. So you want to talk a little about that, Dr. Prachi?
Sure, ma'am.
Not ma'am, please, and
Sorry, I'm
misgenders
sorry.
also.
Sure, sir. I'm
Yeah,
sorry. I just forgot
yeah,
that. I'm really sorry for that.
yeah.
Yes, as I mentioned earlier, that starting your career as a medical officer, I mean, the way you want to be, like, is a kind of complete blessing. Not every trans person gets a chance to prove themselves in the society, and I feel very grateful and thankful to the Mitra Clinic and entire team of Mitra Clinic, where I got an opportunity to start my career again. And yes, only initial days it was only I was only accessible to only to the LGBTQI community itself for almost 1 year, and there I never got any kind of discrimination or problem. But when I got an opportunity to work in Usmania General Hospital, like we say, Janajivana Shravantilo ఎప్పుడైతే కలిశానో, obviously నాకు కూడా, I mean, when even I was,
ప్లీజ్ కంటిన్యూ ఇన్ తెలుగు. ఇట్ బి నైస్
because
యాక్చువల్లీ, కొంతసేపు మనం తెలుగులో మాట్లాడొచ్చు. హలో, ప్రాచి ఉన్నారా?
ఎస్ ఉన్నాను.
సరే, కొంతసేపు తెలుగులో కంటిన్యూ చేద్దామా, సో దట్ పీపుల్ మైట్ ఎంజాయ్ దట్.
ఓకే. సో somewhere like నాకేంటంటే అక్కడికి వెళ్ళిన తర్వాత ఐ ఫెల్ట్ సో హ్యాపీ దట్ ఒక గవర్నమెంట్ సెక్టర్ లో ఒక ట్రాన్స్జెండర్ జాబ్ చేయడం ఒక ఒక రకమైన గుడ్ ఫీలింగ్ అయితే, పేషెంట్స్ irrespective of gender, doctor lagane treat చేయడం is one of the best thing I have seen there. Not only Usmania, I think like as I mentioned, Nizamabad lo kuda, government hospital lo kuda, just because those people are from mostly government hospital lo వచ్చే patients అందరూ they are from low socio-economic background. So వాళ్ళకి ఏంటంటే ఎవరైతే ఏముంది మనకు మంచిగా ట్రీట్మెంట్ దొరికితే చాలు కదా అని ఆలోచిస్తారు. అండ్ సమ్వేర్ దట్ వాజ్ ఆల్సో వన్ ఆఫ్ ది గుడ్ థింగ్ వేర్ వాళ్ళు ఒక డాక్టర్ ని బేస్డ్ ఆన్ దర్ జెండర్ చూడకుండా డాక్టర్ లానే ట్రీట్ చేయటం. అండ్ చాలా వరకు మనకి పాజిటివ్ what we call that positive feedbacks రావడం. We have never seen a transgender working as a doctor in our entire life. And also some kind of things like మీ గురించి ఏమో అనుకున్నాను, బయట మీ వాళ్ళు ఇలా చేస్తుంటే భయం అవుతుంది. But somewhere when we are interacting you and when we are taking treatment from you, we feel very happy that like ఒక transgender person మాకు ట్రీట్మెంట్ చేస్తున్నారు. అండ్ we tell to our families as well, like ఇలా మేడం ఇలా ట్రాన్స్జెండర్ ఉండే అది ఇది అని చెప్పేసి. సో దోస్ కైండ్ ఆఫ్ పాజిటివిటీ ఇస్ డెఫినెట్లీ దేర్. అండ్ what I want to tell the exact point is somewhere మనం barriers కాకుండా direct interaction with the society or cisgender people is very important. Based on assumptions and ఓన్లీ వాళ్ళ కళ్ళతో చూస్తుంది, సోషల్ మీడియాలో చూస్తుంది, లైక్ ట్రాన్స్జెండర్స్ అంటే కేవలం భిక్షాటనని చేస్తారు, కేవలం సెక్స్ వర్క్ చేస్తారు. గేస్ అయితే పింక్ షర్ట్స్ వేసుకుంటారు, లిప్స్టిక్స్ పెట్టుకుంటారు, సైడ్ స్లింగ్ బ్యాగ్స్ వేసుకుంటారు, లెస్బియన్స్ అయితే ఇలా ఉంటారు. సో దిస్ కైండ్ ఆఫ్ థింగ్స్ వాళ్ళ మైండ్ లో ఒకటి ఫిక్స్ అయిపోయింది. అండ్ దట్ ఈస్ ద మెయిన్ థింగ్ వీ హ్యావ్ టు బ్రేక్ డౌన్. సో ఆ ఒక్క దాని వల్ల దే ఆర్ ఆల్సో లైక్ వాళ్ళు కూడా ముందడుగు వేయలేకపోతున్నారేమో అని నాకు అనిపిస్తుంది. అండ్ ఎస్ డెఫినెట్లీ ఆ ఇంటరాక్షన్ అనేది రిపీటెడ్లీ ఒక కమ్యూనిటీ పర్సన్ కి ఒక సిస్జెండర్ కి ఉంటే ఐ కెన్ సే దట్ దేర్ వోంట్ బి ఎనీ స్పెసిఫికేషన్స్ అబౌట్ జెండర్ ఇన్ ఫ్యూచర్.
Wow, yeah. And it's fantastic. It just goes to say, Meeru asalu not just professional, but you're a very compassionate person, because ఒక డాక్టర్ కి అది లేకపోతే అది ఉంటే పెద్ద గొప్ప కాదంటారా? బట్ అది ఖచ్చితంగా ఉండాలి కదా. బట్ మీ దగ్గర అది ఎక్స్ట్రా ఉంది, యాజ్ యు సెడ్. ఎస్పెషలీ వెన్ పీపుల్ ఫ్రమ్ మార్జినలైజ్ కమ్యూనిటీస్ కమ్, వాళ్ళకి మంచిగా మర్యాదగా చూస్తే చాలు. ఎందుకంటే గవర్నమెంట్ హాస్పిటల్స్ లో, ఎంత పెద్ద గవర్నమెంట్ హాస్పిటల్స్ లో, ఏ ఊర్లో అయినా ఒక లక్షల మంది వస్తారు, అలా పడే ఉంటారు. లైక్ చాలా సార్లు వాళ్ళకి సరిగా జాగా ఉండదు కూర్చోడానికి, నుంచోడానికి. వాళ్ళని ఊరికినే అక్కడ ఉన్న స్టాఫ్ కూడా కొంతమంది హింసిస్తారు, అవమానిస్తారు. బట్ అయినా కూడా వేరే చోటు లేకుండా, వేరే మార్గం లేకుండా వస్తారు. కాబట్టి మీరు వాళ్ళని యూ సీ దెమ్ యాజ్ అ డాక్టర్, వాళ్ళు పేషెంట్ అంతే. సర్వీస్కి వచ్చారు, మనం సర్వీస్ ప్రొవైడ్ చేద్దాం, ప్రొఫెషనల్ గా ఉందాము. అండ్ అఫ్ కోర్స్ కంపాషనేట్ గా, నాట్ లైక్ మెకానికల్ ఇది కాకుండా అండ్ ఏంటంటే వాళ్ళు కూడా సంతోషంగా మీరు చెప్పినట్లు ఇంకా మంచి ఫీడ్బ్యాక్ ఇచ్చి వెళ్తున్నారు. బట్ బై ఎనీ ఛాన్స్ వాళ్ళు, ఐ మీన్ కొంతమందికి తెలియకపోవచ్చు మీ ట్రాన్స్, అండ్ ఎస్పెషలీ వాళ్ళు ఉన్న హెల్త్ కండిషన్ లో ఒక్కొక్కసారి వాళ్ళకి ఊహించుకోరు కూడా. బట్ ఎవరైనా స్పెసిఫిక్ గా అడుగుతారా మిమ్మల్ని? అప్పుడు చెప్తారా మీరు అవును నేను ట్రాన్స్ నే అని? లేకపోతే
చాలా మంది అడుగుతారు. అండ్ సమ్వేర్ ఇఫ్ దే ప్రొనౌన్స్ మీ, I'm sorry, like as I mistakenly called you, if they pronounce me madam, మీకు పెళ్ళైందా, మీకు ఎంతమంది పిల్లలు అంటే, I definitely tell them no, I'm a transgender and నేను ప్రౌడ్ గా చెప్తాను, because I only wanted to be that.
కరెక్ట్, వండర్ఫుల్, యా, చాలా సంతోషం. అదే కదా, అఫ్ కోర్స్ మనందరికి మన జర్నీస్ ఉన్నాయి. బట్ మనం మన ఐడెంటిటీతో ఓపెన్ గా ఉంటే అది మనకు ఒక సెల్ఫ్ యాక్సెప్టెన్స్, సెల్ఫ్ ఎస్టీమ్, సెల్ఫ్ రెస్పెక్ట్, ప్లస్ సమ్వేర్ మనం ఒక పాజిటివ్ మెసేజ్ మన కమ్యూనిటీ కోసం. చాలా మంది అడుగుతారు, నేను అంటారు అనమాట, ఓహ్ నేను ఇది విని ఇది చూసే నాకు తెలిసింది అంటే, నువ్వు అలా రివీల్ మనం అది ఎక్స్పెక్ట్ చేయకపోవచ్చు. వీ మే నాట్ ఈవెన్ ఫీల్, వీ మే నాట్ బి డూయింగ్ ఇట్ బికాస్ వీ వాంట్ సంబడి టు బి. బట్ మోర్ అండ్ మోర్ మీరు అన్నట్లు అది ఒక రకమైన మన మీద బాధ్యత లాగా వస్తుంది కదా. లైక్ దట్ ఓకే Okay, yeah, Clementine, yeah, Jesse, babe, there are people who are, sort of more comfortable, so we can't help switching. All we are talking about is the positive experiences Dr. Prachi has had with, uh, you know, uh, her patients. Some of them ask sometimes about her personal life also. Some know she's a trans woman, some do not. But whoever it is, she serves them, very professionally, unconditionally. And she says that, especially because in government hospitals, if you are from India, South Asia, or whichever, you will know that government hospitals, first, the most patients who come there, or the people who come there, are from extremely socio-economically marginalized backgrounds. And so they are the ones who need that extra compassion, care, respect. Yeah, and that's what Dr. Prachi has been providing, and this is not her saying it. I have heard, I can see. Okay. And and that is so important, because as we say, somewhere we feel that when we have expressed discrimination, self-doubt, stigma, harassment, I think automatically it should make us, in some ways, if possible, stronger, but also most importantly, to create or enhance our empathy, right? And as a doctor and as a counselor, I, broadly being in healthcare myself, we have to, that is like a sworn thing. If you are certified, if you are licensed, or whatever, if you are trained to practice, I mean, if you cannot be empathetic or compassionate, it is unprofessional, it's unethical, it's inhuman. That's what I would say. And that is why we have to keep checking ourselves about our
Yes.
behavior. Yeah. Right,
Yeah.
Dr. Prachi, I hope I'm not, sort of being too this thing, but too.
No, perfectly fine.
Yeah, yeah,
Yeah.
yeah. So you wanted to add also about, how it has been like, sort of, you also said, when you were actually leaving the ART center in Osmania, right? People were actually requesting you to not leave or to postpone your studies.
Yeah.
Would you like to? That is so heartwarming to hear, actually, because, yeah.
And
Mm,
to gain that kind of love and affection from the patients as well as staff over there
mm,
within a span of 1 year, I think that is a very good thing. The
fantastic.
only, I mean, the only thing which I mean, I did there is like I was the way I am actually. I was never rude to anyone. I was never like rude to staff or patients. Yes, I think that is one of the main quality where you need in a government hospital. If you behave properly, if you are disciplined, and if you give that kind of respect, yes, definitely you'll get the same thing. And also consistency of doctors in ART centers is actually lagging just because of various co-infections and opportunistic infections. Chala mandi bhayapadi, people were, I mean, many of doctors are scared of those as well. So within a short span lo, they'll resign, or else they only do just for their income source, for the preparation of their NEET PG and all. They leave. But I think in last 5 years, I was the only doctor who was consistently worked for more than 1 year there in Usmania. So that kind of rapport and uh, mana అనే feeling, it has been like patients ki and staff ki kuda వచ్చేసింది, where people were actually telling not to do my post graduation, and they are forcing me like when I decided, I mean, ఆ time లో నేను డిసైడ్ అయ్యాను that I don't want to pursue post graduation for some time. But the only thing which was running in my mind is the interim order which has given by the High Court of Telangana as a 1% horizontal reservation for a trans person in medical field. If I won't join, that will not act applicable for the next year as well. So that was the only thing I had to. I mean, I wanted to join, and yes, ఇప్పుడు కూడా when I go to the ART center, they treat me the same.
Oh my
Like
gosh.
each and every time. So
Sorry, I didn't mean to interrupt you. Yeah.
sure.
So
Yeah.
I think, as I just comment, you are such a fantastic role model and a wonderful ambassador of our queer.
Thank you.
But also, I don't mind reiterating that you're a thorough professional, because that is what, yeah. And just a small, message to healthcare professionals here, especially if you're not from the queer trans community. Here, we are not blaming or criticizing or judging. We are just requesting y'all, if you are new to our community, I think all we need is respect and humane approach or attitude from you, right? So
Yes.
we are in no way trying to find fault with you or anything. Okay.
Yes.
Now, I will return to your current journey, your training to be a surgeon, but also a little bit about your other interests. You said you're interested in fashion designing and dancing and also modeling for photographs. I think in the very brief time that I have known and observed you, I could gather all this. So, yeah. How do
Uh,
you kind of relax or spend your time or unwind?
See, a life before 2019 was very good, I can say. Life after 29 2000 sorry 2019 and life after 2019 is also a kind of good only, but lot of stress, and also like financially not so good, uh, don't have kind of family support, and all these things made me so bad. I was in depression, I was very anxious, I used to cry at home, and the only thing where I used to relax at that time is watching videos on TikTok.
Mm.
Though I was very much, very much interested in dance, and also kind of singing. So I used to overcome all my pain by watching this. I used to overcome by singing and all. So there I got some kind of interest which is continuing right now as well. And yes, the only thing being a trans person, I want to look good. I want myself to look good. I want to feel that a kind of proper change, or a kind of transition in myself. So I do photographs and I watch those. I feel so happy. And of course, watching yourself when you look actually pretty makes you more energized, I guess.
Yeah.
All the kind of negativity which will be running in your mind, you'll forget all these things. And yes, being a doctor, I mean surgeon, pursuing resident, budding resident, life is very tough in medical colleges especially, and also when you are working in a male dominant branch where all the 24 surgeons are male and you are the only trans woman there. So you get a lot of backlash, you get a lot of discrimination there. uh, I was overcoming everything, and yes, I thought of like what we call that, to let it go the scenes, but unfortunately something very bad happened to me, and that was the only reason where I am like against them now. So I can only say life is not so easy for any transgender person who are going to work in any kind of sector. You have to face these kind of harsh realities. But yes, you have to teach them as well. If you be in a kind of let it go type, then they will never realize what the mistake they have done.
Mm.
So So this thing is mandatory, and whatever it might be, no one is snatching your profession, no one is snatching your degree. Today or tomorrow, you'll definitely get that. But standing on the right point and making them understand is very important in our life. So this is all I can say. Like stress will be there, everything will be there. I mean, you'll be very low sometimes, you'll be excited. Uh, but end of the day, life has to move on. Like if you are in pain, you should not stop watching reels or doing reels. What I can say, you should not stop. You should not, especially use. At least you should not stuck that you are low, stuck on the only thing that you are low or you are not doing anything. There are a lot of activities which makes you yourself happy. So yes, being on social media, talking, singing, and all these things are like a kind of relaxation for me. And yes, I really enjoy those.
Wow, wonderful. And you have again, things in such a, what do I say, a open but in a very respectful way. That जैसे बोलते हैं लोगों को आप मतलब उनका गलतियां भी प्यार से निकाल रहे हैं, आप उनको प्यार से सिखाने की कोशिश कर रहे हैं। और बाप रे, इस दुनिया में तो और प्यार का इतना, और लोग बोलेंगे अरे डॉक्टर कहाँ प्यार करते हैं, डॉक्टर से प्यार, हाँ मतलब, लेकिन उसके अलावा क्या है? हाँ, आप इंसान,
एग्जैक्टली एंड
हमें,
यस, प्यार से अगर गलतियां भी निकालेंगे आगे वाला जल्दी मानेगा.
जी बिल्कुल बिल्कुल बढ़िया, हाँ जरूर। हम इंसान हो उन्हें दिखा पाते, अगर इंसानियत नहीं दिखा पाते तो इंसान होने का फायदा
ट्रू.
क्या, मतलब
फायदा कुछ नहीं है. यस.
हाँ हमेशा लगता है कि ना इंसान होके इंसानियत दिखाना इतना मुश्किल है क्या, उसके अलावा क्या है, मतलब ना। एंड और yeah, I mean, I had to sort of, part of me, I can't help switching it to Hindi sometimes, but also hopefully the people, who are more comfortable in Hindi feel that,
Yeah.
yeah, they are being, yeah, addressed. And all we were trying to say, for those who do not understand Hindi, we were saying, what's the point of being a human being if you can't be humane, if you can't show humanity, right? I mean, how can
Yeah.
call ourselves human beings without showing humanity, or and one of the first fundamental basic emotions is love. Okay. And love towards a fellow human being, it doesn't have to be romantic, it doesn't have to be of whatever, it just has to be, because love and respect go hand in hand, right? You cannot, if especially you are in these kind of professions where you say that I have taken the responsibility, I have promised to reach out to other human beings, or help people who reach me for support. I think if we can't be humane and respectful and loving, I think it's pointless. It's a shame what we do not deserve to be in that profession, or call ourselves, whatever, healthcare professionals. I think, Dr. Prachi, you will agree with me on this, that what आपने ही कभी बोला ना कि प्यार से समझा सकते हैं, गाली
True.
भी प्यार से सकते हैं, गलती भी प्यार से निकाल सकते हैं, कि वो
Exactly.
गलतियां निकालना हमारा मुद्दा नहीं है, कि सिर्फ
Exactly.
आपको बदलो, क्योंकि हम भी हैं, कभी कोई परफेक्ट नहीं होता ना, हमें भी गलतियां होती हैं, लेकिन हमें अगर
Yes.
मोहब्बत से, इज्जत से समझाएंगे तो जरूर मानेंगे ना हम। एंड
Exactly.
yeah, and Dr. Prachi, if you don't mind, how you have withstood and surpassed some really tough times, and you were like, you were studying but also doing Basti Badhai. How did you manage? I don't even know if it's a fair question. Sorry, I don't mean to make you relive your. You are
No worries, no worries. I mean, these kind of points should be addressed in, such kind of like platforms, because what I feel is like no work is like తెలుగులో చెప్తారు కదా ఏ పని కూడా చిన్నది కాదు అని. So what I have decided is like when my profession is not accepting my gender, instead of like applying 25 various private hospitals with an interview, just because of gender you're not getting selected, or just because of gender your parents are not accepting, I should accept myself, right? And I surrendered myself. I thought, fine, when the society has given only 3 jobs for a transgenders, I'm talking only about transgenders, uh, begging, sex work, or badai, whatever it is. Initial days, though, everyone are in kind of need. Food, shelter, and survival is very, very important for each and every person, rather than choosing, I mean, thinking on choosing your job is correct or not. So I just focused on that, and I also thought, why should not I do? See, each and every transgender person is going through the same phase. వాళ్ళు కూడా ఇవి చేసే బయటికి వచ్చి ఇంకేదో చేసుకుంటారు. There are many transgender people like who are out and proud about their like what they have did in past and all. So I felt like I was also one of that, and I never want to hide that, because that is the only thing and that is the only earning source for me, which has like given me some kind of confidence that yes, I can survive by my own, and I can also continue my studies by my own. So yes, for me that was the beautiful moment. So yes, I was very much stressed out at that time. చాలా చాలా ఇబ్బందిగా అనిపించేది. Like when people are offering you only 1 rupee, 2 rupee, you yourself feels that ఛీ నేను ఇక్కడ దాకా వచ్చి నేను ఇది చేస్తున్నానా అని ఒక ఫీలింగ్ వచ్చేస్తది. బట్ డిసప్పాయింట్మెంట్ ఉండేది. ఐ యూస్ టు క్రై ఎ లాట్, బట్ సమ్వేర్ ఐ నెవర్ స్టాప్ దట్, బికాస్ అది ఆగిపోతే నా ఎర్నింగే ఆగిపోతుంది. అండ్ సో that was one of the best part where I stood myself, and I was confident about what I have to do in future. Though struggle was there, but that was only temporary, right? So I accepted that and I started forward like working on that. Eppudaithe when I got this thing, I immediately cut off that, because yes, I should not be. It should not go in a wrong way that a transgender person. I mean, a doctor. I mean, a transgender person who is a doctor is also begging. That
right.
that that will be in a wrong way. So yes, then my life was kind of okay. I got a job where at least I can survive with 20,000 to 25,000 per month. So that that was a very, very, I mean, I can only say in one word that that was the best and worst memory of my life.
Right, right. And then it is so inspiring that you are taking exactly what you said now, the best and the worst. You're taking that out of that situation also, which was very tough and traumatic, but still you are saying that it taught you, and then most importantly, it helped you hold on, because that was the way to survive for you. I think it was pragmatic also, uh, very difficult, but at the same time, very necessary. And also, Dr. Prachi, you probably would have noticed, you got lots of hi and hello and love from people who have joined this live. They're probably your fans, your followers, your friends, right? And then, yeah,
Yeah.
so again, we are reminding people, if you want to, sorry, we cannot add people who we don't know to the live, or to people who are not scheduled to be part of it. It's just not correct. It's unethical and unprofessional to do that. And most importantly, you still can continue to send your comments, questions, or anything else, Shay, or greetings. And also, Prachi, I wanted to ask you specifically, going to say people with intersex variants, because as a doctor, right, but also as a trans person, many times, especially in India, or in fact across the world, but I've seen it so much more because I've been working with intersex people for about 7 years. There's so much of, while there are some similarities, there's so much of avoidable confusion between trans and intersex people, not between the communities or the identities, but by people or by doctors. Would you like to say something about, I think, of course, the same kind of empathy is required, but so much misinformation, so much of pathologization of intersex people is also happening. So, again, up to you if you want to comment on this. Would you like to say that,
Yes, yes, for sure.
yeah, yeah,
Yes.
yeah.
Basically, what happening is talking about intersex person in a medical field is also not there.
Mm.
People are not,
Hello?
they exist,
Mm.
right?
Mm.
So that is the kind of medical information which we are getting actually, and no one even stressed on that. When I exactly remember when while I was taking my NEET PG courses. I mean, I have joined for my NEET PG course, and in some institute there where uh, we have to discuss everything about each and every subject of our medicines. There, people are always like, even doctors who are who are teaching us are misjudging by telling that intersex are nothing but they are Downs or Klinefelter syndrome people. So that is one of the like dirtiest experience I can say. Like, I have heard from a doctor. Being a doctor, he should know what an intersex is. And adding on that, he is telling that intersex people are nothing but they are with extra chromosome. That's it. Either with one chromosome less or some extra chromosome, and they look fabulous. They are beautiful. I was like, is that true? So, if a medical profession, if a professor is talking in that way, you just imagine about about normal people. They always misjudge intersex people with females,
Mm.
and most of the intersex people won't identify as an intersex person. They identify themselves as a female only. So there is some lack of, I can say, there is some lack of knowledge about that, and only intersex people who are out and proud has to add a limelight on that. Then only people will come to
Yeah,
know.
sure. Right, right. I mean, it's horrifying. It is very outrageous. I mean, bad enough we see that trans people are mistreated, misjudged, pathologized, whatever, by doctors. I mean, the more senior, the worse they are, unfortunately, in their behavior, in their approach, in their. See, ignorance is okay, indifference and disrespect is completely, unacceptable. But that's what they do. Why, you know, as I was saying, just like we say, in the whole country or maybe in the whole world itself, we won't have too many trans people out and proud as doctors, and intersex people as anything and as even, to be treated as human beings, or any other doctor to say that in a very affirmative manner. I don't know, but I will learn. Just because, say, I'm a psychiatrist, endocrinologist, which are like very relevant professions for intersex and trans people, that doesn't mean I'm an expert on everything and everyone. Yeah, and you're right, and and always them to their body parts, right?
Yeah, Ritashi, we have got a question from
Just
Jesse.
yeah, yeah.
Yeah.
So would you like to
Uh, good
Dr. Prachi?
yes. Very good evening, Jesse. Hope you are doing good. See, taking hormones is like completely your choice, and you have to go for further trying few tests before taking those, and it will be only I request each and everyone, just if you are planning to take any kind of hormones for gender affirming hormonal therapy, then please try to consult endocrinologist itself with the help of a psychiatrist, because when the psychiatrist evaluate you and give the gender dysphoria certificate, then only an endocrinologist suggest you hormones. And yes, as you mentioned, like what are the complications of taking hormones for a longer period? Endocrinologist is the best person to suggest you, but I can only say one thing: taking hormones without knowing your actually hormonal value is dangerous to you first. And also you have to go specific test in each and every, I mean every 3 months when you're taking hormones. And monitoring your dosage of hormone is very important, as well as monitoring your lipid profile, liver function test, and kidney function test is very important, where taking hormones for the longer period, main complication will be distal vein thrombosis. We say like blood clots. And for trans men's, yes, due to taking a lot of testosterone. Testosterone is also a derivative of cholesterol. So lipid profile, I mean your fat level increases in your body, and we are more prone to get heart attacks as well. So you have to monitor your like tests every time. I mean, and also consult and be in touch with your endocrinologist uh, at least once in 3 months to manage your dose. And yes, and also for the old age people, see, here taking hormones in any age is a kind of bad thing only. And using that in appropriate way is also might lead to a lot of complications. So yes, for the older people, if they wants to start the hormones, we have to do various tests like 2D echo. 2D echo is very important for them. And yes, 2D echo is very important. ECG 2D echo is very important and mandatory. You have to access that in every 1 or 2 months. Uh, Monitoring your sugar levels is also an important thing. You have to keep that in mind. And better to take lower doses if a person's age is more than 30. With those comorbidities are there, so better to take very low doses, or better to avoid hormones at that after that age, because the only thing like which might lead in further, further, is like getting complications. So uh, these are the things I have to mention. And please consult your endocrinologist, along with that your physician, in every 3 months if you are taking hormones.
Yeah, thank you so much for explaining that in a very simple manner. That's right, because especially as a counselor, I have seen many adolescents, like or people like, oh, maybe after 18 I can undergo transition. Yeah, why not? Like, I mean, it's shocking and it's sad that they like so many double, triple, just however much of hormones they want without consulting the endocrinologist whenever they want, however they want. I मुझे बनना है, मतलब ना मुझे immediately transition करना है, ये वो नहीं तो worse still, if they're not started on HRT because the clinical psychologist, psychiatrist haven't cleared them for that. I mean, clear that matlab recommended, they get even more disappointed and frustrated. Yeah, gender dysphoria isn't easy. Many of us have gone through, but we have managed it even without hormones. And it is uh, understandable, but it is not, and it is sometimes inevitable. But please do not self-prescribe, self-dose, self-medicate without clinical supervision. And also, it is not just about taking the recommended dose, but also doing like Dr. Prachi said, lipid, kidney, liver profiles, your sugar levels, your cholesterol levels, of course, that come under lipid. Yeah. And of course, any other counseling or something. Please do not avoid all this. Your hormone dosages can be slightly delayed or adjusted on the lower side, but not any of the monitoring of the comorbidities. Okay, so that is so important. Dr. Prachi, are you still there? I think there is some small connection issue,
Yes,
or
yes,
oh,
I'm there.
okay, yeah. So thank you so much for summarizing
Thank
that
you.
so well, especially that very important question. And thank you so much,
Yes.
Clementine.
One more question we have, I guess, if one takes health insurance and after that change their gender,
Oh,
will the health insurance lapse? I just want to add a quick note on this. Health insurance is very important, and we have to take and we have to enroll for sure. But the procedures, the surgical do for our transitions are actually a cosmetology based surgeries. They are already if you take mastectomy or mammoplasty for trans women, vaginoplasty or phalloplasty for trans men, and all these are actually cosmetically corrected treatments. So these won't come under your insurance policies. So if it is a kind of chronic or acute things like for example what we call that liver diseases or something general diseases, so that will be added in insurance. But these kind of cosmetically treated diseases or corrections won't be included in health insurance. So I don't think so health insurance will work. Yes, for your hormonal therapies, I have no idea of that, but somewhere I heard that it will work. But anyways, for us, health insurance is very important because we most of the people are on hormonal therapies, and we also have a lot of complications in future due to our lifestyle changes, which is very important. And for I mean, lifestyle of transgender persons is I mean, it is horrible actually. We won't maintain proper healthy lifestyle, proper sleep and all. So yes, we might get a lot of things in future. So for that, at least we need health insurances, right? And like we have an insurance cover of 5 lakhs Arogya Bhima, I guess. I'm not aware of this properly, where you are supposed to use that in government sectors, but in private sector, we don't have any kind of clarity on that.
okay, yeah, I know sometimes it's health insurance and from provider to provider kind of changes. And yeah, Clementine, you see, this one about actually if people change their gender, it's the same person, so it should not change. But this is something which the health insurance provider should clarify, because I have heard, in the corporate sector, right, more than one person who is, transitioning or not, they say, oh, we will support, when it actually comes to that. Because again, along with this, like the allied or support services, health insurance people also need lots of sensitization, lots of awareness, yeah, on not, it's not just about giving it like some happens in some of the government schemes, right? Bas bana diya to bana diya, actually, is it relevant? What kind of schemes, what kind of coverages are required, what are less necessary or unimportant? So, this is something which, the health insurance sector also should understand. And yeah, but so hopefully it addresses your questions. You want to change your voice from male to female, but without laryngeal surgery. Any reference you can give who can help through voice modulation therapies, exercises?
Usually, what happens, voice modulation therapy works well with trans men, especially from female to male transition. When they take testosterone, I mean, their voice actually changes. But for females, we don't have that kind of like what we call that kind of blessing, I guess. Like we do, if we take a lot of hormones, then also our voice won't change. Laryngoplasty must be there. I mean, you should undergo, but I can only add on this, like only 10% of modulation will be there. There won't be like 100% successful. Only 10 to 20% modulation will be there. And I don't think that voice is a big taboo in our transition process. So that is not a big taboo. Your appearance. I mean, the urge where you want to become a complete female is I mean, it's the only thing happening. You have to be soft, you look pretty, you have to undergo your augmentation surgeries, vaginoplasties, you have to grow your hair, transplantations, and other facial feminization surgeries are more demanding nowadays rather than voice laryngoplasty, I can say. Modulation, I mean, change won't be there, but I can only add one thing. Your speech, if you want to change your voice, and yes, definitely your speech therapist will help you. And self modulation you can do.
Okay, thank
And I won't suggest voice modulation surgeries basically because end of the day, however you will be, people will be identifying you as a trans person only.
you.
No one is going to tell that you are a female or something in the society. And yes, voice is not so much concerned, I guess.
Thank you so much again for these very specific, very insightful, nuanced answers, because finally it's about self acceptance and self respect.
Yeah.
There is no limit to this. We don't have to, because, like they say, there is no one specific definition, benchmark, model, whatever standard for a trans person to look at, to sound like, to seem like, to walk like. Similarly, for
Yes.
so let us go by what we want, what we can, not by the social global definitions of it, because we will never meet, disappointing and hurting ourselves, because a body, even so-called physically, mentally fit body, also cannot take more than a certain level of procedures and surgeries and everything. So accept yourself, your body, and be happy with it. Yeah, because self-acceptance includes our acceptance of our physical self also. Okay, it's also self-care. Yeah, and that will um, also help us lead our lives with less stress. Why cause ourselves more stress than we already have? Okay. So, Dr. Prachi, with this, I want to slowly end this. It's been a delightful, it's been a very, very insightful, a very, very memorable conversation with you. Anything else you
You.
want to share or add or suggest? Um,
Yes, I just want to add two specific points. One is that stop blaming society that they are not accepting us. Start working on yourself first. Society will automatically accept. I have done the same. I was one of the victim, and I always used to blame the health system and like cisgender people that because of them I'm not getting jobs. But I can proudly say today that yes, their acceptance is the main thing where I'm existing right now. So this is one thing I want to say, and second thing, yes, be confident, do whatever you want to do, but don't what we call that, don't portray the same thing which have happened in last 10 years, like transgender who are here only for begging sex work and all. Don't portray, or don't try to continue that. Try to sensitize as much as you can, because see, whatever happened is happened in the past. We can't change that. But from now, it should be a good, what we call, start for the future trans persons who are coming out, and who will be coming out in future, because sensitization is the one thing, and sensitizing parents and sensitization in schools is also mandatory. So we should focus more on that, rather than like pointing out always that community. The system of the society is not giving us anything. So that is the main thing. Like we have to focus more on the upcoming LGBTQI people, rather than like blaming all the time.
Okay, thank you. Very valid, very pragmatic suggestions. Yeah, so it's about give and take, respect, and yeah, and yeah, wonderful. Dhanyavadamalu, shukriya.
Thank you.
तो
चलो,
हम पाव पड़ती नहीं बोलेंगे, लेकिन हमें तो हिजरा बनाए, तो हम बचपन से कम्युनिटी के हैं,
बिल्कुल बोलना
पैदा।
भी नहीं चाहिए।
या सो तो सबको सतरंगी सलाम, बधाइयाँ, और सबको
सलाम।
ढेर सारा। हाँ, ओके,
चलो,
thank you everybody. This has been so enriching and exciting, this conversation. And Dr. Prachi, I will, of course, one on one, we will continue conversations.
sure.
And again, so thankful and honored and happy.
Thank you so much. Thank you so very much. Thank you.
Yeah. So I will, and then, yeah. Thank you also, Clementine, Jesse, for
Thank you.
active participation. Yeah, and we will be back soon with other lives. We will continue. Okay, because as I always like to say, for me, queer joy is about how the rest, everybody in the intersectional queer community, like us, continues to just live day to day amidst all
Yeah.
the trouble, the trauma, the challenges, the ups and downs. Yeah, and of course for the people who are not able to make it also, again, lots of respect and remembrances. Okay, so again, yeah, chala thanks, and
Thank you.
I share this video and add you as a collaborator, so automatically once you do that, of course, it will be on your timeline. Okay, all right, bye bye everybody.
Hello.
Yeah,
Bye. Bye.
bye.
Take care. Bye.